10 warning signs that your liver is full of toxins. It can be hard nowadays to find a dependable and loyal friend that will have your back no matter what. Well, maybe it's not so hard if you look deep within yourself. No, for real, we're talking about your liver. When it comes down to it, your liver is one of your truest and most hardworking friends. It's constantly toiling away to remove harmful toxins from your body so that your whole system can work like a well-oiled machine. Not only is your liver a built-in, ultra-effective toxin remover, but medical books also list it as a master of another 500 functions. Brightside has put together a list of tips to help you recognize when your liver is crying out for help. Number 10. Pain near the liver. Feeling achy in the upper right area of your abdomen is a sign that your liver might be in trouble. The American Liver Foundation lists over 100 possible types of liver disease, some of which are genetic, while others are caused by harmful habits like alcohol consumption and drug use. The pain you can feel in your liver area is usually kind of dull, but at times it gets pretty intense. Remember that the liver's job isn't only to detoxify and help the body filter out waste, but it also plays a role in digesting food and nutritional products. When your liver is affected by some disease, it can't operate efficiently, so it swells up painfully. This is the body's way to signify that it's full of toxins. Number 9. Leg and ankle swelling. When you ignore the problem of a toxic liver, it'll try to repair itself at the cost of forming scar tissue. The more scar tissue there is, the tougher it is for the liver to function, which eventually leads to portal hypertension. This is basically high blood pressure in the veins of the liver, and one of its effects is to cause fluid to build up in the legs. The official smart word for this condition is edema, and the good news is that it's essentially painless. It can affect the legs, calves, or thighs. However, the swelling is most visible in the lower part of the body simply due to gravity. Number 8. Weight gain. Every year, more and more people decide to start dieting and exercising, yet they still struggle with weight issues. If you experience weight gain that doesn't seem to stem from overeating or hormone malfunction, you might want to talk to your doctor about checking out your liver. What happens is the liver can't deal with all the toxins coming in from alcohol, artificial sweeteners, a high-fat diet, certain medications, and so on. The only thing it can come up with is to store the unfiltered toxins in fat cells. You know, like when people have nowhere to put their stale gum, so they just stick it under the table. Ew. We really hope you don't do that. Anyway, toxins stuck into fat cells will definitely not let you lose weight unless you help your body cleanse the overworked liver. Number 7. Loss of appetite. This one might sound like a dream for those of us who want to lose weight but can't resist all the sweet and fatty temptations around. However, loss of appetite is no fun and no joke. A disinterest in food accompanied by nausea and weight loss could be an early symptom of liver disease. It all starts with flu-like symptoms and only gets worse from there. A liver that can't work properly to flush out toxins will give you digestive distress. This causes excessive and unexplained vomiting. Yuck! Word of the wise, don't risk it. If you have any of these symptoms, do not hesitate to go to the doctors to find out the true reason why donuts just don't excite you anymore. Number 6. Chronic bad breath. There are certain foods that are known for giving us pretty rank-smelling breath. While garlic gives you transient bad breath that can easily be taken care of with some gum or a Tic Tac, there are also more serious causes of this embarrassing symptom. By the way, if stinky breath is something that concerns you, watch this video featuring 15 surprising daily do's and don'ts to avoid bad breath. Chronic bad breath is obviously caused by problems in your mouth, right? Well, yes and no. Remember that the body is a complicated system where everything is interconnected in some way or another. The bacteria from your mouth actually travel down into your digestive system and can cause problems with digestion and metabolism. Bad breath, in turn, could be a sign that something is wrong with your stomach or liver. There is even a special scientific word for bad breath caused by liver disease, fetor hepaticus. Normally, it comes before other symptoms of liver damage, so it is really important that you don't ignore it. We're halfway through the list. Make sure to watch this video till the end not to miss out on any warning signs of liver damage. Better safe than sorry, right? Hit the thumbs up if you agree and keep watching. Number 5. Allergies. This one might surprise you, but allergies are often the result of an overloaded and sluggish liver. When there are too many substances entering the bloodstream, the brain sees them as allergens and releases antibodies and chemicals, like histamines, which cause itchy rashes. Just like chronic bad breath, itching normally comes before other more obvious symptoms of liver damage. The allergic reactions are especially severe on the palms and soles of the feet and give you a particularly hard time in the evening or at night. A happy, healthy liver, though, cleans the blood of all the harmless molecules and eliminates the effect that a potential allergen has on the body. Number 4. Yellow skin and eyes. When a person's eyes or skin turns yellowish, it's known as jaundice. Jaundice itself isn't an illness, but rather a symptom of possible conditions. It normally appears when a diseased liver makes the body accumulate too much bilirubin, which is a yellow pigment formed by the breakdown of dead red blood cells in the liver. Guess what happens when the liver fails to get rid of bilirubin along with old red blood cells? That's right, you turn yellow, like a Simpson. Number 3. Dark urine. This one is a result of jaundice too. Along with the yellow skin and eyes, dark-colored urine is an indicator that there's too much bilirubin in your body. Your kidneys just keep doing their job and try to remove it naturally no matter what color it is. So when it comes out during urination, it's shockingly dark. When we say dark, we mean like shades of orange, amber, or Coca-Cola brown. It's okay for urine to change its color a bit when it's affected by what you eat or drink. However, if this color change becomes constant, that's reason enough to call your doctor. You might be in even more trouble if dark urine is accompanied by light or bloody stools. Number 2. Bruising easily. We all get nicks and bruises from time to time, especially if you're a little on the clumsy side. Show of hands, anyone? Bruises are harmless and can sometimes tell a hilarious story, like taking a fall because you were trying to dance like Beyoncé on the coffee table. But it's no laughing matter if you're the one who tends to bruise more easily than others. It's a reason to get a health check, especially for your liver. A bruise is a result of some injury to the blood vessels in your skin, and one of the very many functions of a healthy liver is to produce proteins for blood clotting. When your liver's protein factory is out of order, your blood vessels get weaker, resulting in easy bruising and bleeding. Number 1. Chronic fatigue. Constant stress and the hectic lifestyle most of us have these days can wear anyone out. However, constantly feeling more dead than alive can't just be explained by a crazy workload. Chronic fatigue syndrome resembles a prolonged flu-like illness and is only diagnosed when someone experiences the symptoms for at least 6 months. The reason behind this is intoxication of, you guessed it, the liver. The liver, to a large extent, contributes to the energy supply in the body by turning glucose into glycogen and storing it for later use. A healthy liver pours out glucose between meals or whenever there's a need for nourishment and energy. A diseased liver, however, can hardly produce glucose and has very little space to store it. For those of you who are already calling an ambulance or planning your own funeral after hearing all this, please remember that noticing the slightest symptoms of a failing liver isn't the end of your life and well-being. Try to look on the bright side. That's what we always recommend, right? The liver can heal itself. Just give it a break from a destructive lifestyle. Yes, it's as easy as that. Cleansing the liver is all about healthy habits. Scientists also say there are a number of natural products to boost liver performance. So from now on, try your best to make green tea, lemon water, turmeric, and organic fruits and vegetables your BFFs. How would you define your current lifestyle? Are you doing your liver any good, or are you stressing the poor thing out? Share with us in the comments below. If you like this video, use that handy-dandy thumbs up button to let us know. If this video gets 300,000 likes, we'll share some health tips to keep your liver in the best possible condition. Subscribe to our channel to get the latest updates and stay with us on the bright side of life.